Chasing that number might actually be putting you in danger. I am Dr. Mandell, and I have spent years studying how the aging body responds to blood pressure treatment. What I am about to share is not a theory. It comes from clinical trials, peer-reviewed research, and what cardiologists tell their own family members privately, the number you were given may be too low for your body at this stage of life, and the damage from pushing too hard to reach it can be silent, slow, and serious. Stay with me because by the end of this video, you will know what your safer number is. Let me start with something most people never think about. Where did 120/80 come from in the first place? For decades, doctors and researchers looked at large groups of adults and found that people with blood pressure around 120/80 had fewer heart attacks and strokes, so that became the target. Simple enough, and for many years nobody questioned it. But here is the part nobody explained to you when they handed you that prescription. Most of those early studies were done on younger adults, adults with healthy kidneys, healthy brains, and no long list of medications, not on someone who is 65, managing 2 or 3 health conditions and already taking for pills every morning. After 60, your body changes in ways that matter enormously for blood pressure. Your arteries become stiffer over time. Think of a brand new rubber hose. It bends easily, stretches, handles pressure well. Now think of an old garden hose left out in the sun for 10 years. It is stiff, brittle, and much less flexible. That is exactly what happens to your blood vessels as you age. Stiffer arteries mean your heart has to push harder to move blood through. Discover more product reviews and price comparisons. AI transcription tool, transcript translation tool. Your body and your brain, your kidneys and your heart actually start to depend on a slightly higher pressure to function properly. So when your doctor aggressively pushes your numbers down toward 120, your body cannot always keep up. The blood supply to your brain drops, and that is when people start feeling dizzy in the morning. Foggy in the afternoon, unsteady on their feet, and exhausted for no clear reason. Here is the thing that worries me most. A fall at 65 or 70 is not just a bruise. A fall can mean a broken hip, a hospital stay, or worse. And according to a 2019 review published in the Journal of the American Geriatric Society, aggressive blood pressure lowering in older adults significantly increases the risk of falls and fall-related injuries. You were never told that part. That is exactly why this conversation needs to happen. Now let me tell you about the study that changed how many cardiologists think about this. In 2015, a large clinical trial called the SPRINT trial studied over 9,000 adults with an average age of 68. Researchers split them into 2 groups. One group aimed for a blood pressure below 120 systolic. The other aimed for below 140. The group targeting 120 had fewer heart attacks and cardiovascular deaths. And from that moment on, many doctors started pushing even harder for that lower number in older patients. But here is what almost nobody talks about. Read the fine print of that same study. The SPRINT trial excluded anyone with diabetes. It excluded anyone who had already had a stroke. It excluded people with dementia. It excluded those with advanced kidney disease, and it excluded anyone with serious frailty. In other words, the people being studied were the healthiest, most active, most resilient older adults. They were not the typical person over 60 who is watching this video right now. And even within that carefully selected healthy group, the lower target caused more dizziness, more fainting, more kidney problems, and more dangerous drops in blood pressure when standing up. A second trial called the STEP trial done in China in 2021 with over 8,500 adults aged 60 to 80 repeated these findings. Yes, lower blood pressure offered some heart protection, but the side effects in real-world patients were significant and often ignored. The guideline was not built for everyone. It was built for a very specific type of healthy older adult. And if that is not you, then chasing 120/80 is not protecting you. It may be quietly hurting you. Let me explain what is actually happening inside your body, because once you understand this, everything else will make perfect sense. Your brain is an incredibly demanding organ. It needs a steady, consistent flow of blood at all times to keep you thinking clearly, staying balanced, and feeling energized. When you are young, your brain can manage fine, even if blood pressure dips a little lower. The blood vessels going into your brain are flexible and can adjust quickly, but after 60, something called cerebral autoregulation starts to shift. This is just a fancy term for your brain's ability to control its own blood supply. As your arteries stiffen, your brain actually recalibrates. It starts to rely on a slightly higher blood pressure just to get the same amount of blood it always needed. So when a doctor pushes your pressure down aggressively to 120 or below, your brain does not always get enough blood. The result, you feel dizzy, you get brain fog, you feel tired even after sleeping 8 hours, you feel slightly off balance when you walk. There is also something called orthostatic hypotension. This is when your blood pressure drops too fast when you stand up from sitting or lying down. In older adults on aggressive blood pressure medications, this is extremely common and extremely dangerous. According to a study published in Hypertension in 2020, orthostatic hypotension is associated with a 40% higher risk of falls in adults over 65. Your kidneys are also affected. They need adequate pressure to filter your blood properly. Pushed to low and kidney function can actually decline instead of improve. So lower is not always safer for your body after 60. The goal is not the lowest possible number. The goal is the right number, the number that protects your heart. Without starving your brain, destabilizing your balance, or straining your kidneys. Before we move on, tell me in the comments where you are watching from and how long you have been dealing with blood pressure issues. If this is making sense of something you have been trying to understand for a long time, subscribe to my channel and hit that notification bell so you never miss a video. If this is helping, type great in the comments or improve if it does not. So what is the right number for you? Here is the framework that many cardiologists now use when they sit down with their own patients, and it is built around 3 real profiles. If your doctor told you to get your blood pressure down to 120/80, they were not wrong. But after 60 profile 1, you are between 60 and 79 years old. You walk regularly. You are mostly independent. You do not have major conditions like kidney disease or dementia. You do not get dizzy when you stand up. If this sounds like you, a target below 130/80 is appropriate and the research supports it. The cardiovascular protection at this level is real and the risk of side effects is relatively low for people in your position. Profile 2, you are between 60 and 79, but you manage more than one health condition. Maybe you have diabetes, kidney issues, or you are already on 3 or more medications. Maybe you sometimes feel ladded or unsteady. For you, the safer target is between 130 and 140 systolic. Pushing below 130 in your situation is not more protective. According to the 2021 American College of Cardiology guidelines on hypertension management in older adults, aggressive targets in this group can cause more harm than benefit. Profile 3, you are 80 or older. Here the research is very clear. A systolic target between 130 and 150 is considered safe and appropriate depending on how you feel day to day. If you are hitting 120 and feel completely fine with no dizziness or fatigue, some additional heart protection may be possible. But if you feel even slightly unsteady or foggy, 130 to 150 is where your body is telling you it needs to be. The bottom line is this: we are not treating a number on a machine. We are treating a person with a unique body, unique history, and a unique set of risks. And the number that keeps you alive and feeling good may not be the same number your doctor learned in medical school 20 years ago. Now here is the part I really need you to pay attention to because your body is already sending you signals. Most people just do not know what they mean. If your blood pressure target is too low for your body, here is what you will feel. First, dizziness when you stand up, especially in the morning. That brief spinning feeling or rush to your head is your brain not getting enough blood fast enough. Second, brain fog during the day. That fuzzy, slow, hard to concentrate feeling that you may have been blaming on bad sleep or aging. It can be a sign that your blood pressure is being held too low. Third, unusual tiredness that does not go away even after a full night of rest. Your organs are working harder than they should because the pressure driving blood to them is insufficient. Fourth, feeling unsteady on your feet. Not quite dizzy, but not quite solid either, like the floor is slightly uncertain beneath you. Fifth, blood pressure readings that regularly dip below 100 systolic. Even if your average looks fine, frequent dips below 100 are a red flag that your target is too aggressive. Sixth, muscle cramps or electrolyte issues. Some blood pressure medications, especially diuretics, flush out potassium and magnesium. If you are cramping regularly, your medication dose may be working against you. Your body is not being dramatic when it sends these signals. It is being precise. And if any one of these describes you right now, this is important information to bring to your doctor at your very next appointment. Now, let me give you something practical because Information without action does not help anyone. Too many people watch a video like this, nod along, feel informed, and then walk into their next appointment and say nothing. I do not want that for you, so here are 3 things you can do before your next doctor visit that will completely change the quality of that conversation. Step 1, figure out your profile. Go back to the 3 profiles I just described. Be honest about which one matches your real life right now, not the life you had at 55. Your life today. Your activity level, your conditions, your medications, your symptoms. Know your profile before you walk into that room. Write it down if you need to take it with you. Step 2, track how you feel alongside your numbers. For the next 7 days, every time you take your blood pressure reading, write down how you feel in that moment. Are you dizzy? Are you foggy? Are you tired? Are you fine? Bring that log to your doctor. A week of how your body actually responds to your current medication is far more useful than a single reading taken in a clinical setting while you are sitting upright and slightly nervous. Step 3, ask one specific question. When you sit down with your doctor, ask this exact question. Given my age, my conditions, and the symptoms I have been tracking, what is my personalized blood pressure target? Not the guideline average, my target. That single question changes everything. You are not questioning your doctor. You are giving them better information to work with. You are being a better patient. And any good doctor will welcome that conversation and respect you for having it. And if this gave you something useful, something you will actually take to your next doctor visit, please hit that thumbs up button right now. It takes 2 seconds and it helps this information reach more people over 60 who need to hear it. I want to be completely straight with you about what the research says and what it does not say, because I think you deserve honesty, not just reassurance. The SPRINT trial of 2015 and the STEP trial of 2021 both showed real cardiovascular benefits from lower blood pressure targets in specific groups of older adults. That is real. That is not in dispute, and I am not here to tell you those studies were wrong. What the research also shows clearly and consistently is that those benefits come with real trade-offs in many older patients. More falls, more kidney strain, more dizziness, more medication side effects. These findings are documented in peer-reviewed literature and are increasingly reflected in how practicing cardiologists counsel their patients today. The 2023 updated guidelines from the European Society of Cardiology specifically acknowledge that in adults over 70, blood pressure targets should be individualized based on frailty, kidney function, and symptom tolerance, not set at a uniform number for everyone, a 2022 paper published. In JAMA Internal Medicine also found that in adults over 75, overly aggressive blood pressure control was independently associated with increased rates of kidney injury and cognitive decline over a 2-year follow-up period. This is not about avoiding medication. Medication saves lives. This is about matching the target to the person, and right now millions of older adults are being chased toward a number that was never validated for their specific situation. Science does not say lower is always wrong. It says lower is not always right for everyone. There is a significant difference. I want to leave you with something real, and I want you to sit with it for a moment. Getting your blood pressure target right after 60 is not about a number on a chart. It is about standing up in the morning without grabbing the wall. It is about a mind that is sharp and clear before your first cup of coffee. It is about being steady on your feet when you walk across a room. It is about driving yourself to appointments without that anxious uncertainty. It is about being fully present with the people who matter most to you, whether that is a grandchild, a partner, or a close friend. You have spent decades showing up for everyone else. You have worked hard, taken care of your family, and pushed through more than most people will ever know. The least you deserve is information that actually fits your life, not a guideline written for someone half your age with half your history. The number on that blood pressure cuff is not a verdict. It is a starting point for a better conversation. And now you know how to have it. If this video gave you something useful, and if you have someone in your life managing blood pressure, share this video with them. It might be the most useful thing they watch this week. Subscribe if you have not already and hit the notification bell so you never miss what comes next on this channel. Actually, before you close this video, there is one more thing I want to show you, because everything we talked about today is about managing blood pressure smarter. But what if you could also lower it naturally starting tomorrow morning with something that cost about 50 cents and is probably already in your kitchen right now? Most cardiologists never mention it. Made a full video on exactly that ingredient and how to use it. It is right there on your screen. Watch it next. It is going to surprise.